Welcome to part two. I try to break these up into 15-minute increments so you can at least use the bathroom or get something to drink or take a nap. Anyhow, as we're talking about is a correlation between the economy and the Affordable Care Act. Um, and why that's important is because the economy is um, measured in what we call the gross domestic product. And the GDP, one of the fastest growing parts of the GDP is healthcare consumption, which is over 17% now. And that's very significant. The other interesting thing is that the healthcare law, the Affordable Care Act, um, came into really came into law during the Great Recession, right around the same time, or shortly thereafter. Anyhow, so what's interesting is it's been difficult to measure the impact, positive or negative impact of the Affordable Care Act, which goal is to really bend the cost curve. In other words, to slow the rapid growth of healthcare costs. It wasn't to stop it, it wasn't even to reverse it, it was just to slow it from something like 3% or 4% per year to at least 2% per year. And Uwe's video talks about um, if we didn't slow it by just a couple points, um, I think it was by 2030, GDP, healthcare's portion of GDP would be 40%. And that would drastically change everything. So as we go through this, the correlation between employment, insured people, um, labor force. All these things are important because there is a lot of criticism about the ACA making what was considered a very weak and fragile recovery worse because some of its provisions, such as the mandate. Um, so then, why would employers hire people if they are mandated to insure them, or why would health insurance companies stay in the business? Um, or they would, and they'd just jack up the premiums. But then a law was put in place where you couldn't have more than, I think, 16 or 18% of your administrative fees going to non-healthcare related services. So it's pretty interesting times considering insurance companies primarily at the time and pretty much still now are um, financial services companies. What's happening now for insurance companies to be successful, they have to actually become disease management companies, um, and those that are successful at that will be in the game for the long haul. So let's get back to where we were. Okay, so here we're looking at the annual growth spending. Growth slows to a rate of GDP growth for 4 years. Okay, so from 2010 to 2013, basically, as GDP growth was, um, which it looks like it was something around 4%. Let me see. Let's say around, yeah, a little more than 4%. Healthcare stayed around 4%. Now, if you look at healthcare, I mean, look at it, how dramatic it is in terms of costs. It's just, GDP is this and healthcare is that. So here's a Great Recession. Essentially the bottom drops out, but healthcare costs don't go down. I mean, well, let me rephrase that. They're going down, as I mentioned, but they're not going down as dramatically as the rest of the economy because it's healthcare. People need healthcare, they'll consume healthcare, and as long as somebody else is paying for the healthcare, which is one of the few, if not only, industries where the consumer is not the actual purchaser of the product. You tend to have a big gap in behavior, purchasing behavior. In other words, if my employer was willing to pay for all my furniture in my house up to a certain limit, but certainly more than I can afford, well, guess what? I'm going to buy that furniture right up to that limit. Same thing with healthcare. And that's known as cost insulation. In other words, the employee was insulated from the true costs of healthcare. And then over time, things like copays and deductibles began to initially were designed to uh, change behaviors. In other words, if I had to pay $10 to get a prescription, maybe I would think twice about constantly refilling it or getting more antibiotics. It wasn't a big, large amount of money, but enough to make me think twice, right? What's that opportunity cost? Um, then what happened is it became obvious to employers and to insurance companies that, hey, the dogs will eat it. In other words, people will tolerate this. Why don't we shift more of these costs onto them, not only to change behavior, but to save money? And that's when we really started to see a shift in terms of consumers taking a bigger portion of paying for their health care. Um, and like with everything else, some argue that was just a sort of a risk-based economy. In other words, there's no pensions anymore. It's 401k. So instead of a company giving you a defined benefit, then no matter what the market does, you're going to get, like a teacher, $2,000 a month regardless. Those are gone, and now we're at risk of the market. Same thing as was argued with healthcare from the liberal side, is that big business is just essentially taking more profits and shifting the risk onto us. So it all depends on how you look at it. Anyhow, so that's what we're seeing here. And now we're seeing in 2013 uh, healthcare rising. So now that can be for a couple of reasons, right? I'll let you think about what those reasons could be. Okay. Um, Let me think. A number of ACA reforms, particularly related to Medicare, have likely contributed to the slowdown in healthcare spending growth by tightening provider payment rates and introducing incentives to reduce excess costs. And being on the provider side, that is true. Um, it's a golden rule. Those who have the golden rule, and Medicare is 60% of payer source. Um, faster than expected economic growth and slower than expected healthcare spending have led to multiple downward revisions of the federal deficit and projected federal deficit. Because remember, there was, it wasn't more than 5, 6 years ago, we were going to have this incredible deficit just simply because of the American Reinvestment Act, that our grandchildren would be, just working salt mines just to pay it off. I mean, it was just these horrible, horrible pictures that were painted. Um, but the true economists like Uwe and some of the others, that there was no fact behind that. It was just scare tactics. Anyhow, so because of what's been happening, economic growth has picked up, and healthcare hasn't picked up, has allowed us to really reduce the deficit, which is pretty amazing. In other words, it's just showing another relationship with healthcare in our society and in our economy. These trends have also been a boon to state and local government budgets. As job growth has improved, state tax revenue, um, while cost growth in healthcare programs has slowed, has really helped. In other words, I can tell you from the companies I've worked for, you're having a good year, but you're always sweating, what's the premium going to be this year? Is it going to be 10%, 15%? And when you're talking 10 or double digit premium increases on part of your operating budget, say it's a $10 million, $20 million operating budget, in your, um, let's say your healthcare cost for a $10 million operation is, little more than $500,000, and then you got to worry about a 10% premium increase. Yeah, that's worth an FTE. So, which is a full-time equivalent person, employee. So it's a pretty scary thing. So in other words, the slowdown has really helped. Um, so at the same time, um, we're also seeing expanding insurance to millions of people who were previously uninsured, has supported local health systems and enhanced families' ability to pay for necessities, including healthcare. And that's one to really understand because when you think about it, all these folks are now getting covered who weren't covered before. So we initially intuitively think, wow, well, more people getting covered. That means somebody's paying for that coverage, and they're probably using resources. And I think part of this um, upward swing is folks who didn't have insurance getting insurance, utilizing it for hopefully primary care, um, versus not utilizing anything, getting very sick, and then using the hospital, which is probably a lot of this. Um, so, anyhow, the accrued savings in healthcare spending relative to their projected growth prior to the Affordable Care Act are substantial. Medicare alone is now projected to spend 1 trillion less between 2010 and 2020. 1 trillion less. That's really significant. Um, that far, I think, outstrips any real expectations um, when the whole law was put together. But think about it though. Medicare, 60% of a payment source for most people, including physicians and hospitals, nursing homes, and so slight changes there, big changes there, can really have an impact. So, uh, market slowdown in Medicare and private spending growth per enrollee. So, percentage change in spending growth per enrollee. So, here's Medicare and private. So, what you're seeing here is a Medicare spending growth is definitely slower because the government's controlling it. But what you're seeing here, private insurance is actually not necessarily slowing. In some cases, it's slowed, but now it's growing again. So again, it's not the entitlements that everybody complains about; it's private health care. So, without targeted efforts to sustain slow growth in the near future, market forces could reverse these positive trends. In consolidation among providers and insurers and rising administrative complexities could put the United States back in the path where costs increase faster than the economy and people's incomes. And this would, of course, undermine the affordability of insurance. So, 5 years after the passage of the ACA, we have evidence that it is possible to secure affordable coverage for all citizens, which is really cool, and improve health outcomes and slow cost growth, all to the benefit of families, businesses, and economies. This is very significant. So just think about that, and I'll post some discussion questions in lieu of our chat as you review these slides, and um, and we'll go from there. And again, I apologize that we couldn't do the chat. It wasn't working, and I couldn't get a hold of anybody at Charter Oak to put that together. So anyhow, so do me a favor. There's a few more slides here. Medicare hospital admissions for potentially preventable conditions down 25%. That's a big deal because I'm working on that. Healthcare sector gained 1.4 million jobs in ambulatory. Sharp drop in uninsured. And then what the future might look like. You can pause this so you can take a little more time to take a look at it. And here's our sources. So look forward to chatting, well, to having a discussion in the